Hello, everyone. I'm Julien Grosjean, and I'm glad to present you this work called Using Clinical Data Warehouse to Optimize the Vaccination Strategy Against COVID-19. And it's a use case made in France, specifically in Normandy. So I will not present you the general background and context about the COVID-19, but only the context of the vaccination strategy held in France. So it began in early 2021, and the prioritization was done to people in nursing homes to start with, and then for elder people, and then in mid-February and March, people with high risks of developing severe forms of COVID-19 were targeted to be vaccinated. So people with comorbidities. So the French Health Authority, the HAS, published a list of diseases or conditions, as you can see here, 5 items, cancers, some cancers, some chronic kidney diseases or organ transplantations, and a large list of rare diseases. And second, we are developing for several years in Rouen, in Normandy, the EDSEN, which is a clinical data warehouse that collects more than 20 years of clinical data, about 2 million patients. So this health data warehouse is pseudonymized and have been approved by the CNIL, the French agency for the data security, in 2020. Today, the EDSEN contains lab results, drug prescriptions, diagnosis-related groups, the DRG codes. Those 3 data types are structured data, it's codes and well-structured informations in databases. And the DRG codes are very important because in France, but also in many countries, this system is used to manually code the diseases, the procedures of the patient who come in the hospital. So it's very important data source for us. And in addition to that, we are also dealing with unstructured data, which mean the clinical narratives. So various types of documents, of written documents in French, obviously, such as discharge summaries, letters, and so on. So this data source is very important, as we will see in this study. So the objective of the study was to use the EDSEN clinical data warehouse to automatically identify patients that could be prioritized for vaccination of COVID-19. And we use the HAS list as an input to the original list of contagious diseases. So this work was done in Rouen University Hospital, which is the main hospital in the region of Normandy. So we build this method. First of all, we have to identify the target data types that should be used for each condition or disease, which means should we use unstructured or structured data, or both, to try to respond to a specific question of disease condition list. And then we have to translate each disease condition into a specific EDSEN query in the EDSEN system. Then we had to process and export the final list of patients. And then in the 4th step, we had to re-identify people because, as I mentioned, the EDSEN database is pseudonymized. So we cannot, if you are using EDSEN, the IDs are random IDs, and you cannot, it's not public ID, so it's meaningless. but we have a software that could be used only by 3 or 4 members in the hospitals to identify the list of patients exported from Edson. And then we have to exclude this patient from 2 sources, because in the Rouen University Hospital we have a list of patients that passed in the hospital, but in France we also have a complete list of the deceased persons, the French people, in a public database held by the INSEE. So we can, with names and birth dates, find if people are deceased or not. So we used 2 filters, additional query filters. So because at the beginning of 2021, only adults could be vaccinated. So it was a filter between 18 and 75, because 75 plus were already taken into account for the vaccination prioritization. And the second filter was about patient who came at the hospital after 2016, because we wanted to maximize our chance to recontact them. So for the results, 34 disease conditions in the HAS list were taken into account, and 23 queries were built, 3 only with DRG codes, so ICD-10 codes, because it was judged sufficient for us. The precision of the recall were judged excellent. 4 with DRG codes and unstructured data, clinical narratives. So we use an approach of mixed queries, and 16 only with unstructured data, because there were not ICD-10 codes, or the ICD-10 code were maybe too fuzzy, or sometimes wrong. And obviously 11 disease condition cannot be translated, and the main reason the main reasons are, first, the fuzziness of some sentences, and sometimes it was very difficult to understand what we could how we could translate it for the computer, because here the main problem is to translate something that could be understood by people, and more precisely by physicians, and translate it into a computer system is very tricky sometimes. So the 2 examples are patient with deficit of interference. So it's very fuzzy to see what's kind of deficit is that, and some another example is myopathies with forced vital capacities less than 70%. So it's very difficult to modelize it. Some examples of queries that we managed to build. The first one is on DRG code. So here it's coded Z, so all coded Z. 9480 here. It's very precise, and the recall is judged excellent for this patient of hematopoietic stem cell transplantation. So as you can see, only 11 patients in 5 years. So, but it's judged enough to query DRG codes. The second example is, on the contrary, using clinical narratives and especially keywords in drugs prescription, because rituximab is not a structured data in our hospital. You cannot find this kind of drugs prescription in the structured way. So we have to deal with keywords. And as you can see, we can build a Boolean query, the OR operator, to introduce variants of words, of expression, of keywords, to be sure to have the maximum recall. As you can see here, the molecule and the drug name are used. So it's very interesting, because we can also think that we manage to retrieve patients that have been treated in the hospital, but also in the outside of the hospital, because it was they came for something, for a reason, but we cannot say if this treatment was done in the hospital or outside the hospital. And the final example is the more interesting one. It's about combining DRG codes and clinical narrative. So it's about chronic pancreatitis and diabetes. And as you can see, we can search with the keywords here in French and associate it with the ICD-10 codes here. So it's very important, because we can increase the recall of the query, because the ICD-10 codes are not always put in the health record of the patient, because it's not always very rarely relevant in the context of the hospitalization. So as a result, we have more than 7,000 unique patients identified thanks to these those queries in ETSAM, and we identified more than 1,700 patients deceased, and so as a result, we found 6,000 patients, and several patients have 2 or more listed disease incarnations, as you can see. For the discussion of this study, we can start with the strength of this approach. So it's very fast. This is the main advantage. So when you are dealing with a query, you spend several minutes, sometimes maybe at maximum 30 minutes to build a query, and then it's very fast to query large amount of data, more than 20 years of data in seconds. In less than 5 seconds, you have the result for each query. So it's very fast. You can scan automatically millions of records, and it's very valuable for people. You can increase precision and recall with that, and mix queries, instructor and instructor data. It's very important, because we estimate we can increase recall and precision with those mixed approach, and it's very interesting, because most of the systems now are only dealing with one type of data. So if a system is able to query both data types, it's very interesting and very fast. So the weaknesses of this approach. In the clinical narratives, we have to deal with natural language processing algorithm, and it's never perfect, because we have some difficulties to manage all the ways that could be used for physicians or nurses to express the problems of the patients, what they have done to them. So it's very complex. And then the second point was about building queries, as I mentioned earlier, building queries from fuzzy conditions, diseases in the beginning. So actually, it's very important results that we cannot today build all the queries has from physicians. So it depends on the complexity of the demand. And finally, we have set a time limit to this study to maximize our chance to recontact the patients. So as a conclusion, clinical data warehouse are very valuable tools to identify patients. And if it's relying on powerful query softwares, you can use both structured and unstructured data to increase the recall and the precision. And for us in Rouen, it was a very good use case because we showed that we were able to use this Edson clinical data warehouse for other purposes than research. Because here it's all about prevention, and it's a very important result for us. Thank you.